That I would agree with. Yes. So we are recording. And I would just like to ask our friends at the Green Institute, I think Linda might be there. Is it possible for me to be able to share my screen? Yes, here we are. Thank you. And then can we also be aware that sometimes people join us and they forget to mute. So if our friends in the green room can be aware of any sounds like that we might need muted, we'd appreciate that. Okay, Dr. Maibach, so it's 1 o'clock right now. So if you don't mind, I'm going to introduce you and then we can get our program started.
Let's do it.
Okay, fantastic. Good afternoon and good evening to all of our friends out there on the internet joining the green room. My name is Jason McSparron, and I have the privilege of being here today with Dr. Edward Maibach, the director of Mason Center for Climate Change Communication in the state of Virginia, the United States. Today, we're going to be talking about climate change communication, enhancing public understanding of climate change. Okay, so please, what I'd like to say at the onset is I'd like to invite our audience to address questions to, yes, I'd like to invite our audience to address questions to Dr. Maibach in the second half of our program. Anyone who has joined us before understands that the first 30 minutes or so, we will be having a conversation. I will be asking Dr. Maibach some really interesting questions. And then in the second half of our program, we really like to open up the questions to our audience. So you'll be able to ask questions directly by raising your hand or putting questions into the chat room. Okay, so great. I'd like everyone to welcome Dr. Maibach. I'd like to tell you a little bit about him. Dr. Edward Maibach is a distinguished university professor at George Mason University, and he is the director of Mason's Center for Climate Change Communication. His research focuses on understanding and promoting public engagement in climate change issues. In 2020, Ed was awarded the Stephen H. Schneider Award for Outstanding Climate Science Communication, along with his colleague, Anthony Leisowitz. More recently, Dr. Maibach was identified by Reuters magazine as one of the world's 10 most influential scientists working on climate change today. Ed has previously served as Associate Director of the National Cancer Institute and as Worldwide Director of Social Marketing at Porter Novelli International. He holds a BA in Psychology from the University of California, San Diego, a master's degree in Public Health from San Diego State University, and a PhD in Communication Science from Stanford University. Ed is a fellow of the American Association for the Advancement of Science and serves on the board of the Global Climate and Health Alliance. Again, our friends in the green room audience, please welcome Dr. Edward Maibach to our program. Greetings today, Dr. Maibach. And if you don't mind, from now on, I'll actually address you as Ed.
That'd be great. Thanks, Jason. And thanks for inviting me to have a conversation with you.
All right, fantastic. So Dr. Maibach, I'd like to get started out. I think it's really useful for us to kind of set the context and talk to the audience a little bit about the really interesting and necessary dynamic work that you and your colleagues are doing at the George Mason's Center for Climate Change Communication. So my first question is, you as the director of the George Mason Center for Climate Change Communication, could you please inform our audience about the really valuable research that you and your colleagues are doing at this time through the center?
Yeah, no, thank you. Happy to do so. You're familiar with the concept of a think tank, no doubt.
Certainly.
We like to think of ourselves as a think and do tank. In other words, our research center, we are very much about the research, and our research focuses on unpacking, helping to understand what members of the public understand about climate change and what do they misunderstand about climate change. And we also try to identify what is it that we can share with people about climate change based on fact, based on the realities of what science is telling us about our changing climate. So what can we share with people that will make a difference to help them understand it better so that they will become better able to make decisions of consequence about how to react to it, both individually, as a member of their family, as a member of their community, and as a citizen of their nation. So, that's the think part. That's our research that we conduct, public understanding of climate change. The doing part in our think and do tank is, once we identify potentially actionable insights, we actually like to test them out in the real world. So, the findings of research can be very interesting, but until you actually prove that the insights are actionable and they will make a difference, we're really kind of left in the lurch. So we feel like our highest value proposition is not the research, but is proving that you can take the research and use it to improve public understanding in the world. I'll give you a quick example.
Great.
One of the very first surveys that we conducted here in the United States in the fall of 2008, we thought to ask our survey participants, who do you trust as a source of information about global warming? Because trust is so important. In the world of public communication, where there is no trust, there is no acceptance of the information. So trust is all important. And what we learned in response to that question was a little bit surprising. The first two things we learned weren't surprising, but the third thing we learned was. So we learned the most trusted source is scientists. Okay. Not surprising. I will share with you a little fact about my fellow citizens here in the US. Most of us can't name a single living scientist. So when pollsters call us up and ask us to name who we consider to be the most important scientists working today, 2 out of 3 Americans won't even give it a shot because they can't name a single living scientist. So the notion that scientists are the most trusted is interesting, but it's somewhat, let's just say it's somewhat of a hollow victory, because if we don't actually know scientists, we aren't going to be routinely turning to them and listening to them and asking them, well, what is it about this global warming thing? So the second most trusted, also not surprising, but a bit of a hollow victory, is our friends and family members.
Okay.
We expected that, because trust, to a very large degree, we trust people the most that we know the best and that we care about the most. So it's not surprising that our friends and family are our second most trusted source. But since our research has shown very clearly most people don't know very much about climate change or global warming, again, it's something of a hollow victory, because we can't really turn to the public to educate one another. Right. But the third most trusted source was the surprising one. It was TV weathercasters. So at the time, 2 out of 3 Americans say they had a lot of trust in TV weathercasters as a source of information about global warming. Okay. And just as you just did, Jason, that's what we said. That's really interesting. And as a matter of fact, within a week of publishing that finding, putting it out there for the world to see, a TV weathercaster here in my local media market in the Washington, D.C. area, he called me up in my office and he said, Ed, I'd like to come out and talk to you because I saw the results of your survey. And that's really interesting. I didn't know that me and my colleagues around the country, that we were highly trusted as a source of information about global warming. I want to work with you to develop a reporting resources program to help me and my colleagues start educating our viewers about the local impacts of global warming. And that has become that. It started off with that one phone conversation. It proceeded to us surveying weathercasters and learning that half of America's weathercasters said, wow, I would really like to educate my viewers about global warming, but I'm not doing so now. So we pilot tested it in one place in a very conservative part of America called Columbia, South Carolina. And we found that with working with one weathercaster over the course of a year, his viewers in Columbia, they learned so much more about the personal relevance of global climate change than they had ever known before. And once we knew that it worked, that actionable insight that I talked about before was in fact a really important insight because we could use it to improve public understanding. We then set about building this into a national program. And now, like our marketing research showed 10 years ago, half of America's weathercasters have rewritten their job description, if you will. They are now actively educating their viewers about the local ramifications of global climate change. And we've done research to show that it's making a difference. America is enjoying a real awakening to the realities of human-caused climate change, especially over the past 5 years. And we know that TV weathercasters are playing an important role in that.
Oh, that's a really interesting story. Again, it goes to show the value of science because, again, it took a scientific project to identify who are the most trusted people in our lives. And then you can target, those people to actually do some really necessary work in terms of, again, identifying the television weather people who, again, who doesn't, everyone's interested in finding out what's going on in the weather. Again, they're not always accurate. However, they are more and more accurate with science. And they're always likable people. So people often very much enjoy the weather, right? In the weather, people who are presenting the weather. So that's a really important approach. And it sounds like to me like you're developing a project that's really actually making some positive inroads in this really difficult time where we have so much mis and disinformation around climate change. It's good to have people actually working to dispel some of that in the public view. This is great. So I actually wanted to congratulate you because pardon me, Lex, could you please mute yourself? Lex Climactica. There we go. Thank you. Yes, in 2020, Ed, you and Anthony Leisowitz were awarded the Stephen H. Schneider Award for Outstanding Climate Science Communication. Can you tell us why you two were recognized for this award? Can you tell us a little bit about the project that was recognized, please?
Yeah, happy to. Well, I can tell you that Tony, his name is Tony Leisowitz. Tony is a phenomenal communicator, so he deserved the award just based on his own communication skills. He really is one of the world's great climate communicators. Whether I'm a good climate communicator or not, I'll let your viewers, audience members make up their own mind. But we are getting some feedback. If we could have everybody go on mute, I think that would help.
Right. Kathleen Caswell, there we go. Thank you.
Terrific. So I believe the reason why Tony and I were given this award, and we were given it together, is because we are research partners. Tony's center, it's called Tony's program called the Yale Program on Climate Change Communication, and my center called the George Mason University Center for Climate Change Communication, very similar names. We created our programs, our centers at the same time in 2007. And we have been working very closely together ever since. So that polling that I talked about a few moments ago, that's a poll that we call Climate Change in the American Mind. We've been conducting it every 6 months since the fall of 2008. And that's a joint project of our two research centers. We have we conduct a lot of other research together, and we develop programs together as well. But the reason that we were given the award is not because of our communication work per se, but it's this because both of our programs, we focus on doing research that will help other trusted voices out there in the world become more effective as climate communicators. We see that fundamentally as the focus of our research. What is it, as I said before, what is it the public understands? What do they misunderstand? What could be shared with them, which is in fact based in science, that will be helpful to them? And our two research centers are working together to identify excuse me, answers to those questions so that lots of trusted communication voices, whether they are individuals like yourself and myself, or whether they're organizations. I'm proud to say that NASA, the US Space Administration, NASA is an avid user of our audience research. They run a fantastic website called NASA, climate.nasa.gov. And they use our work to strengthen the programming, the information that they create for climate.nasa.gov. Any of you who haven't visited that website, I'd highly encourage you to. It's really a phenomenal resource for climate education.
I would agree with that. I've actually visited that website myself, and not only do they have really interesting reports, but they actually have really good graphics in some really, really animated graphics that people can work with to really see, how things have progressed over time. And they have models that are making predictions for potential futures. So it is a really interesting and dynamic website. So that website again was
Climate.nasa.gov.
Climate.nasa.gov. Thanks very much for that. At this point, I'd like to just take a few seconds and kind of like a commercial break here and let our audience know about a few things that are happening here. I'd like to just point out the George Mason University Center for Climate Change Communication website. People can take a look at. Again, the mission there is to develop and apply social science insights to help society make informed decisions that will stabilize the Earth's life-sustaining climate and prevent future harm from climate change. So I would suggest that people in our audience take a look at this website. There are links to current research projects, some of which we might mention today in our conversation, as well as a debunking handbook that will be mentioned for those of you who are dealing with interpersonal debates, whether it's among family members, colleagues, or friends, that you want to try to have a good debate in which is based on facts. And the handbook talks about approaches to dealing with these debates when we're dealing with some people who may have misinformation or disinformation supporting their arguments. Another thing I'd like to just mention is that if you were to go to the Green Institute website, that is Green Institute, www.greeninstitute.ng, you can find Adenike Akinsumulu, the director of the Green Institute, latest book titled The Principles of Green and Sustainability Science. Okay, this book focuses on the principles of green and sustainability science using various case studies, methods, and concepts. Contributes to the literature on environmental science field by expounding on natural systems and approaches to maintaining a better balance between humanity and the natural world in the current Anthropocene era. Okay, let's return back to our conversation. And I can stop my share here. Interesting, there we go. Okay, and end the share, okay. My screen is sharing, I'm sorry, just give me one moment here. Trying to end the share, stop the share, there we go. Okay, so my next question revolves around, I want to return back to the award that you received. And when you received that award, you made a statement, and in it you said, as a public health professional, I'm battling to save the Earth's climate because doing so is necessary to protect health and well-being of everyone alive today and all who are yet to come, especially the least privileged of us, who are the most vulnerable. For even the chance to be useful in this way is an honor beyond measure. And that's the end of your quote. Can you please help our audience understand the links between climate change and public health beyond the obvious negative impacts of severe weather and catastrophes? Please, Ed.
Yeah, so that's a complicated question, Jason. And you know, as a communication scientist, I know it rarely helps to get too complicated in explanations.
Okay.
So I'm going to start in the following way.
Sure.
If any members of your audience haven't read Ministry for the Future,
okay,
I would highly recommend they read that book. And I'm going to give you a trigger warning. Anybody who's read the book knows what I'm about to say. Anybody who hasn't read it, you need to brace yourself. It starts tough. It starts with a massive public health catastrophe that plays out in India about 3 decades from now. And I believe tens of millions of people lose their lives as a result of an extreme heat event. Such an event has not yet ever occurred on that magnitude, but events like that have occurred in various places around the world over the past couple of decades. And because our climate is getting warmer, they're almost certain to occur with increasing frequency and increasing severity going forward. So I've read various numbers about, for example, the heat wave in Europe in 20, oh, I'm blanking the year. It was within the last decade, but 70,000, by best estimates, I believe 70,000 people died prematurely as a result of that heat wave. Wow. And we have seen more, additional catastrophic events like that occur over the past decade. So that is, this opening of the Ministry for the Future, which essentially is opening our eyes to the fact that we could, in fact, and we're likely, in fact, to have catastrophic extreme heat events that kill tens of thousands, if not hundreds of thousands, if not millions of people. This is a real possibility unless we rise to the challenge of preventing that from happening. So that's my first answer to your question. One of the ways, one of the impacts, or one of the reasons why climate change, why I see, as a public health professional, why I see climate change as the world's most pressing public health problem is because we are increasingly dealing with extreme heat events and heat kills. A second consequence of climate change is it's making air pollution worse. Because it doesn't cause air pollution, but it makes air pollution worse in the sense that hot temperatures bake the chemicals that are the constituent components of air pollution. So when you have during heat waves and during hotter summers, you're more likely to get worse air pollution as a result simply of the warmer weather. A third impact, so air pollution is the second impact. A third impact is dangerous storms, right? We are all seeing in almost every corner of the world, we are all seeing with increasing frequency more and more violent, dangerous storms that harm, that cause injuries, cause deaths, and cause lasting mental health impacts from people who had loved ones who were harmed, or who themselves were harmed, or who were dislocated, who were driven away from their home as a result of the ferocity or the damage by that extreme weather event. So that would be a third way in which climate change is a human health issue. And there are actually 8 distinct ways, but I think I'm going to stop on number 4. And number 4 is one that I've been thinking about a lot lately and starting to do research on. And number 4 has to do with the fact that if you really understand climate change and you really understand how bad this could get going forward, it's pretty hard not to feel anxious about that. It's pretty hard not to be depressed about that. And there's lots of clinical, anecdotal evidence that rates of clinically diagnosable anxiety and clinically diagnosable depression are very much on the rise as a result of people's concerns about climate change, especially so among the world's young people, because they know that they're actually going to be the ones who live long enough to see the worst of what is to come. And that's a tough thing to, that mental health is good. Mental health is a blessing. Bad mental health harms are really a curse. And we, if this is in fact true, and I do believe it is true, although I would like to see, I continue to collect data and I want to see other people's data. But if in fact there is a large and increasing burden on people's mental health as a result of climate change, we need to start thinking long and hard about what can we do about that? How can we help people get beyond impaired mental health and go directly to engagement in enacting solutions? I don't have data on this yet, but I personally believe that the best medicine, the best prevention for fighting mental health disorders is being productively engaged with other people, with creating things, with thinking about things other than yourself, with creating things that help, programs that help people. Those are the ways of engaging positively. And while to think of those as mental health prevention measures, I actually think might be the right way, the best way to think about why we should all be getting engaged.
Very good insight, very good information for us to hear. Yes, because I think that a lot of people are dealing with this. This has actually been something that I've been reading about over the past, several months as we started a new semester. And I'm teaching at a college, and we are on campus for the first time in over a year. And again, this has come up in class. Students are concerned. We were following the COP26 negotiations pretty closely. And some students, while there are some students who are optimistic about the outcomes, the COP wasn't such a success as people were hoping in terms of setting national determined goals and promoting the transition to renewables and the financial support from the global north to help the global south transition. So yeah, so we can see where mental health is an issue because we're facing existential threats that are actually coming home. People are seeing the results of climate change here in the U.S. as well as internationally. You can see the drought in the Sudan that has now become torrential downpours and became floodings. There are droughts throughout the Sahel. We're seeing the fires in western part of the United States and Canada, right? And then the hurricanes, the strong hurricanes that we've seen on the East Coast and in the Gulf as well. So students and people are aware, as you're saying. And, it's not a good idea to keep those concerns to yourself. So it is good to seek community. I'm glad that your institution is working to share good information, not only on facts and how to discuss the facts, but also about, how to go about finding help and taking care of our mental health as well. Yeah, very, very promising.
Can I add a note about COP26?
Yes, please.
Because I was at COP26. This is the first COP I had attended. Okay. I had not attended in the past because I frankly didn't feel it warranted adding to my own carbon footprint to get on a plane and fly to some part of the world where to engage, to bear witness to really important conversations. I felt unless I actually had a role to play, I could just as easily bear witness from my chair here or my chair at the office. But this time I actually felt the need to be there because I was part of an unofficial delegation of health professionals. And we were working to try to get the nations of the world to become much more ambitious in terms of their NDCs, because our health, the health of our children, the health of our grandchildren, that's what's really at stake here. And it's pretty hard to diminish the reality of that as long as that is part of the conversation. Right. But it was very humbling. No, humbling is the wrong word. It was very, I'm not sure I have the right word. It woke me up. It was very sobering when I realized maybe we had 250 of our colleagues with us, 250 health professionals out of the 30,000 people at COP, okay, when there were 500 unofficial delegates who were fossil fuel industry lobbyists there. So yes, we were outnumbered at least 2 to 1. And moreover, we knew that those fossil fuel lobbyists had much better access to the delegations than we had. And this is what's at stake. And this is why it's so important to reveal and shine a light on what's at stake: human health and well-being. And so these arguments about, these arguments about whether or not we allow fossil fuel industry to continue to operate unabated, for decades while they take their sweet time to get on board of, with plans to decarbonize our world, it's completely incompatible with the notion of a safe world, leaving a safe world for our children and grandchildren, because the IPCC has made perfectly clear that every 1/10 of a degree of warming beyond 1.5 degrees centigrade will have a palpable public health cost.
Right.
And so, this is as I understand the world as a public health professional, the world's most important public health goal must be to limit global warming to no more than 1.5 degrees. And I personally can't stand by to watch fossil fuel lobbyists, have better access to the world's decision makers, because we need to elbow our way to that table and make sure that they understand what's really at stake.
I'm really pleased that you brought that up. Actually, I was aware that the largest constituency there were fossil fuel lobbyists. That was highlighted in several news outlets, while the COP was going on. So again, I'm really glad that you brought that up, and I really appreciate you as a public health and a public health scientist talking about the challenge to get to the table and actually get the audience with the actual decision makers. Again, because we're looking at the way that these summits are set up, and there is inequity in access. And from my perspective, possibly it seems from your perspective as well, the fossil fuel industry should not be the key leaders in terms of setting the terms for these negotiations, and especially when we're talking about the time horizon for a drawdown of fossil fuel energies. So yeah, no, I appreciate that comment. Thanks for bringing that up. At this point, what I'd like to do is I'd like to encourage people from our audience to start to think of questions. If you raise your hand, then I will allow you to come on live and you can ask the question live. If you'd prefer, you can also put your question in the chat room, and then I'll read the question to Dr. Ed Maibach for you. Okay, but while people are thinking about their questions, I don't see any hands raised just yet. So I'll ask another question. And then at the end of my question, we hope to have a question or two from the audience. So what I'd like to do is I'm really appreciate that talk about the international community and approaches to drawing down greenhouse gas emissions and talking about future targets, et cetera. But I want to draw our attention to some of the really interesting research that is going on about the United States and mis and disinformation in the United States that's being done at the Center for Climate Change Communication. So one of the articles that Ed, you are a co-author on, is titled Global Warming's 6 Americas, a review and recommendations for climate change communication. And in this article, you and your colleagues identify 6 distinct but internally consistent audiences who respond differently to the issue of climate change. These categories are alarmed, people may be concerned, may be cautious, may be disengaged, may be doubtful, or even dismissive. Please explain to the audience the analytical process that helped you and your colleagues determine these categories, and help us understand the attributes of these 6 positions.
Yeah, happy to do so. And your question raises a sort of a broader issue and something that's really important to talk about. And that is, well, I'll make it personal. When I started, I'm a public health communication expert by training. I've worked on the HIV pandemic. I've worked on anti-vax, the anti-vax movement around the world, a whole variety of different really important public health challenges. But when I finally realized that climate change is the biggest public health threat we face, I decided this is it. This is all I'm working on from this point going forward. And I had to introduce myself to members of the climate science community, because I knew that I couldn't engage by myself. I had to engage as a member of a community, and I desperately needed to deepen my own understanding of climate change. So the first community I introduced myself was the climate science community. And they, at the time, let's just say this was 2007, at the time they had a view of public understanding of climate change that intuitively I knew couldn't be right. They viewed climate change or public understanding as either, the public got it or the public didn't get it. And that seemed overly simplistic to me based on all of the work I had done on communicating about other public health issues. Okay. So the very first, again, coming back to that very first survey that Tony Leisowitz and I conducted, we analyzed the data. We subjected it to something called an audience segmentation analysis, looking for patterns of people who understand the issue, think about, feel about, and possibly are responding to the issue in similar ways.
Okay.
And because we knew it, we strongly suspected it wasn't just like those people who got it and those people who rejected it. And in fact, what the data showed us is here in the US, there were at the time, and it is still true today, there were 6 distinct ways of thinking about global warming. And as you said, where they range from, on one end of the continuum, we call them the alarmed, and on the other end of the continuum, we call them the dismissive. And the 4 groups in the middle, they really are arrayed on a more or less linear continuum. But here's the important point, at least one important point. 6 years ago in the US, there were more or less the same number of people at the alarmed end of the continuum as the dismissive end of the continuum here in the US, about 12% of each. And over the ensuing 5 or 6 years, the dismissives have shrunk. Essentially, people have walked away from the dismissive camp and they've walked into one of the other camps, while the alarmed has almost tripled in size.
Okay.
And that's why I said earlier, there's this profound awakening of about climate change going on in the US.
Right.
We have the work that we did, we call it Global Warming 6 Americas, has been replicated in other countries around the world, lots of other countries. I couldn't even name them all off the top of my head. Some of them use our exact same research methodology. Some of them simply use the sort of the general idea we were working with. All of them find the same pattern of findings, that there's a diversity of audiences. Typically, there are many more people in the concerned and the alarmed audiences than in the doubtful and dismissive audiences. And that's really important. It's important for many reasons, not the least of which, coming back, for example, to my TV weathercasters, when my TV weathercasters were of the belief that their audience was split right down the middle, and so if they reported on the local impacts of climate change and engaged the half who accepted the realities of climate change, they were worried that they would alienate the other half of their viewer base, possibly driving them to some other news channel, which would be bad for them, bad for their career, bad for the news channel. And what we showed them with our polling data is actually the proportion of Americans in your community, and we downscale this data all the way down to the community level, so that our weathercasters and other journalists and public health department directors and others can understand what the distribution of views is in their community. And even in the most conservative communities in America, the majority of people are still alarmed, concerned, or cautious, and a relatively small minority are doubtful, dismissive, or disengaged. The disengaged segment has actually almost disappeared since we first started this study 12 years ago, which is good, because the disengaged were disengaged not because they didn't care, not because they aren't interested, but because they told us essentially that, look, I'm working 2.5 jobs just to pay my rent. These were people who are at the lower end of the socioeconomic strata. They're working twice as hard, and therefore they have less time to pay attention to anything other than literally bread and butter issues. Right. But so the 6 Americas has been, as I said, exported around or adopted in other places around the world. The pattern of findings is remarkably consistent, and knowing the distribution in the 6 Americas helps organizations who are trying to help enhance public understanding of climate change. It helps them tailor their educational efforts more effectively based on the actual understanding of members of their target audiences.
Excellent. Again, your research is really valuable, and those anecdotes that you're mentioning just again highlight how valuable it is. Again, working with the news weather people, helping them understand again that the whole idea, if they had a bifurcated audience, it's really true that they would be cautious and not want to alienate any of it when in their audience. But you help them see the dynamics and how dynamic the audience actually is, and the fact that the audience, from your research, is really interested in that information, looking for the factual information. So again, I really see a lot of value in the work you're doing. And I'm glad that we're, again, able to highlight it here on our program, The Green Room. We do have our first question for Dr. Maibach from Curtis Basinger. Curtis, would you like to ask Dr. Maibach your question, please?
Yeah, I sure will. And listen, thank you for bringing up the human health aspects, because your center sponsors the medical consortium for medical societies on climate change, and it's great. The comment I had was that the Lancet and New England Journal recently published an editorial calling climate change the greatest threat to human health. I put a link to that in the chat. Along those lines, you talk about communication, and my request and my suggestion would be to use your medical society consortium to come up with messaging that individual physicians can incorporate into their practice. You know, you listed 3 trusted sets of professionals, and at least with regard to health, a physician is ranked at the top by most surveys that I'm aware of. So I'd highly recommend that you develop messaging that can be used by individual practitioners and as a group by medical professionals. Thank you.
Curtis, thank you for that recommendation. I couldn't agree with you more. And let me tell you that that I too strive to keep my mind open to evidence, because it wasn't long ago that I was, I'll say, skeptical about the value of clinical health professionals taking their precious time to counsel patients in the exam room. My thinking was, well, the patients are there for a reason. They're anxious, they're upset, they're uncertain. They don't really necessarily want to hear their pediatrician or their asthma doctor, you know, talking to them about global warming. Turns out I was wrong. And let me tell you who taught me that I was wrong. He's a pediatrician in Madison, Wisconsin. His name is Andrew Lewandowski. I had this conversation with him, let's just say 1.5 years ago, and he said, Ed, I think you're making assumptions that aren't well grounded in the truth of how things work during, for example, a well child visit. So pediatricians, they get to see their patients once a year or somewhat routinely when they're well and when they're not sick. So Andrew developed a 45-second counseling script. He counseled something to the effect of 250 patients sequentially, or it's really families, right? His patients are children. They come in, generally speaking, they come in with their parents. And so he wove this 45-second counseling script into 250 well child visits. And then he evaluated how his patients and their parents reacted to it by sending them a brief survey. He brought the data to me. Looking at the data with him convinced me I was wrong. Madison, Wisconsin is not the most conservative part of America, but it's up there. It's a pretty conservative place. And his conservative patients, they actually responded very well to his 45-second climate and health counseling. And we have since published that paper in the Journal of Climate Change and Health. And it absolutely has opened my mind to the potential of exactly what you're recommending, Curtis. So yes, whether we at the Medical Society Consortium write that script, or whether we find scripts that other people have written and pilot tested and have evidence to show they work, then we will use our distribution channels to try to get it into the hands of many more doctors and nurses.
Fantastic. Yes. Thank you very much, Curtis, for that question. That was a very, very informative answer as well. Thank you very much, Ed. Ed, our second question comes from Amy Spark. Amy, if you could please unmute yourself, you can direct your question right to Dr. Ed Maibach, please.
Great. Thank you for the opportunity to ask the question. Ed, I've read a lot of your work, and so it's a pleasure to hear from you in person. I am a sustainability professional, and I work at a post-secondary. And so I work with a lot of people that I would say are in the alarmed category, but are actually, it almost feels like they're getting to that fatalistic category. I don't know if that's a new category or if they're being pushed back into kind of just not feeling like they're alarmed, but they're so fed up with their governments and their elected officials that they are almost getting to a bit of that kind of agnostic or fatalistic stage. And so I'm finding it hard to communicate to that audience, and I was hoping you could give some advice.
Okay.
Yeah, Amy, that is such a good, important observation. I see it myself all over. My dear friend Michael Mann, in his book, The New Climate War, talks about doomism. You know, the fact that people who feel that way, feel that the horse has left the barn and there's nothing we can do about it. He pushes back on that pretty hard. He said, you know, while it's understandable why you feel that way, it's fundamentally unhelpful. Because as I said earlier in the conversation, every 1/10 degree of warming that we prevent is going to be preventing palpable, measurable, you know, highly consequential public health harm. So this whole notion of it's too late, we're screwed, if you will, it's wrong, it's unhelpful, and it's wrong, because while we might not be able to limit the warming to 1.5 degrees, while we might not even be able to limit it to 2 degrees, let's hope that we can limit it to the extent that is still possible. And there is a lot that we can do to limit it. Theoretically, at least, it's still possible to limit the warming to 1.5 degrees. And so that's part of my answer, Amy. The other part of my answer has to do with a conclusion that I've reached over the past 10 years, as I've, as a public health professional engaging in the issue of climate change. It's finally dawned on me that climate solutions are also human health solutions. And so one of those ways in which climate solutions are human health solutions is they will help us prevent many tens of degrees of warming that in the future will be highly problematic. But there's another way in which climate solutions are health solutions. As soon as we take the actions that are helpful for our climate, we enjoy additional benefits for our health. So in my county, we still have a coal-fired power plant. We would really like to shut that thing down. It will have perhaps an undetectable benefit in terms of limiting global warming, but it will have a profound benefit in terms of cleaning up the air in the water in my community right away. And we will all, the people in my community right away, will enjoy better health. Yet another reason why I feel it is so important to keep pushing the narrative, the science-based, reality-based narrative that climate change is a human health problem and climate solutions create profound human health opportunities, is it helps, in addition to focusing us on the future, where we should be focused, it also creates benefits in the here and now and in our community. And even the most jaded person, the most jaded member of the alarmed, I think they can appreciate the fact that it sure would be nice to have cleaner air, cleaner water, and better health here in our community, or even here on our campus. Maybe it's not air quality, cleaning up the energy supplies to have cleaner air. Maybe it's just a better, I don't want to go to recycling because I'm somewhat pessimistic about the value of recycling, but there are actions, a greening of the campus, right? A really thoughtful program about literally greening the campus, more tree canopy, permeable surfaces, reflective roofs, and what have you, will create a campus that is better for people's health and frankly, a lot more enjoyable to spend time at. So focusing on the short-term benefits can be motivating above and beyond focusing on the long-term benefits.
Great. Very good question and a fantastic answer as well. In the last 10 minutes, I just want to reference one of the resources that you have at the center. It's the Debunking Handbook. And I think that this might be valuable for some of the people in our audience. So I do want to highlight it. So the 2020 Debunking Handbook is a resource put together by the Center for Climate Change Communication. And I was wondering if you could tell us a little bit about it, the certain strategies it suggests to employ when one is confronted with misinformation, and then what steps should one take to correct misinformation or disinformation in these interpersonal debates that we're having with friends, family, and colleagues, and other folks that we run into when climate change becomes the topic of discussion.
Yeah, I'm happy to speak to that, but I also want to limit expectations. So when often I find that when people want to engage with me about the Debunking Handbook, They do so with the, I'm going to use the word naive belief that there's a silver bullet out there, that if we only have that silver bullet, we can finally be the one who turns our cranky uncle, you know, our dismissive uncle who we're just so sick of hearing his climate denialism. We can find this, the debunking handbook is going to give us the secret weapon to turn him around. It really isn't so. Once people feel very committed to a point of view, especially if their identity is intertwined with that point of view. And many many people in the dismissive category, their identity in here in the US as Republicans, conservative Republicans, and their beliefs, their skeptical beliefs about climate change, they're very tightly interwoven. Right. So to have the belief that we're going to turn our cranky uncle around with some catchy quips, it's just not happening. But here's the really important point in the handbook, and that is we know that every effective public communication campaign in human history, that successful public health communication campaign in human history, they have all succeeded on the basis of having simple, clear messages that are repeated often through a variety of trusted voices. Okay, the misinformers, the perpetrators of misinformation campaigns, they know this all too well. They are masters of confusing the public by developing simple, clear messages that happen not to be true, or at very least they are misleading. They find ways of repeating them over and over and over again, right, achieving that message repetition. In the case of the fossil fuel industry, they are so rich, their paid advertising budget is inconsequential to them and is inconceivable to those of us who are doing climate science communication. Certainly, right. And they also know how to find trusted voices. So right now, the fossil fuel industry is using the voices of their own employees. Perfectly wonderful, decent people doing great work, and they shine a light on those people in their company who are doing great work. For example, trying to commercialize algae as a biological source of fuel. And it's true, they're doing that. And they have wonderful scientists who are doing that. But to shine a light on them and to assure us that we got this, don't worry, go back to sleep, it's deeply misleading. So the way we, unfortunately, with regard to debunking misinformation, we're outgunned by the other side, who has simpler messages because they don't really worry so much about the truth. They have the ability to achieve message repetition way above and beyond what we do, because they have the money to pay to buy their way into our attention span through advertising, public relations, online digital marketing, etc. And they're very smart about knowing who the trusted sources are. So to debunk, we have to, I'll say we need to fight fire with fire. We need to use the same formula. We need to take the complexities of what we know about climate change, and we have to render them as simple, clear messages. Despite the fact that it's boring as heck to repeat yourself over and over and over again. I want to come back to that in a moment. So people who are trained in science are not really comfortable with the notion of repetition. They feel like the data should speak for itself, and they don't want to sully themselves by sounding like they are salesperson for the data. And ultimately, though, as Curtis said, for example, health professionals, doctors and nurses and climate scientists and others, emergency management professionals, firefighters, these are all trusted voices in every community around the planet. We need to take the simple, clear messages that we know work to debunk misinformation. And we need to ask members of those communities, doctors, nurses, firefighters, emergency management professionals, etc. We need to ask them, encourage them, and show them why they should put their trusted voices behind sharing these simple, clear messages. That is our most powerful tool in debunking information. But I want to come back to my caveat that I led with. Don't expect that you're going to change your cranky uncle's mind. But there are coming back to the 6 Americas. the segment next to the dismissives, which we call the doubtful, you may change their mind. The dismissive, you absolutely can educate them. And the cautious, which is a large group of people who understand there's a problem but don't feel any sense of urgency, you can do a pretty good job of helping give them a renewed sense of urgency. So, challenging misinformation is important, but don't worry about the technical side. Don't try to be a climate scientist if you're not a climate scientist. I've been at this for almost 15 years now. I never, ever make the mistake of allowing myself to be represented as a climate scientist. And Jason, I want to come back to that Reuters that Reuters designation that you noted at the top of the hour.
Mhm.
When people, Reuters identified me as one of the most influential scientists in the world working on climate change. But I immediately introduced myself, as I did today, as a public health professional, first, foremost, and always. And that is the hill that I will stand on, and if necessary, I will die on. If I try to stand on the hill of pretending to be a climate scientist, I'm going to come up short every time, because I'm not one, because I can't mount an argument based on detailed, nuanced understanding of climate science, even though I've been doing this for 15 years. And the reason why I make this point is I don't want anybody in your audience to feel like you have to have an encyclopedic knowledge of climate science to challenge obvious misinformation.
Right. Okay, that's really great to hear. Again, good advice, presented very clearly, and useful advice that we can take to heart in the daily conversations that we have with the people around us. It really is, in summary, you're telling us to be clear and concise, and you repeat the facts, but we don't have to have an encyclopedia of knowledge. We just really need to stick with what we know and utilize reliable sources to inform ourselves, but also to inform the debates that we are engaged in.
Right. And if I can add one thing to that, in our research, we've learned that there are 5 key facts
Okay.
that differentiate the American, that essentially determine where on that 6 Americas continuum a person falls. Okay. And the 5 key facts, I can share them with you in 10 words.
Okay.
It's real,
Real.
meaning global warming is happening. It's us. It's human caused. Human activity is causing the current climate change.
Okay.
Experts agree. We used to say based on the evidence, more than 97% of the world's climate scientists are convinced of human caused climate change. But now the number is so much higher, depending on how you ascertain the number. It's somewhere north of 99%, if not all 99.99%. So it's real, it's us. Experts agree. It's bad, meaning not just bad for plants, penguins, and polar bears, because almost everybody understands that global warming is bad for polar bears, but most people don't understand how it's bad for us. So it's bad for us, people. And then finally, there's hope. Coming back to Amy's point earlier, to really push back hard on people who say it is hopeless, there's nothing we can do. People like that, our research shows, they're not engaging. And we need them to engage. If they understand that it's real, it's bad, experts agree, it's real, it's us, experts agree, and it's bad, we don't want them sitting on the sidelines. We want them rolling up their sleeves and engaging. And to do that, they have to believe there are actions that we can take that will make a difference. And the good news about that is it's totally true. There are so many actions we can take that will make a profound difference.
I appreciate that message. And I think with that message, we coming up to the top of the hour, which is the conclusion of our program. So again, I really am pleased to have Dr. Ed Maibach in the green room today. Very grateful for him taking time out of his busy schedule to talk with us about the work that's going on at the George Mason Center for Climate Change Communication. I really do want to thank our audience for showing up today. I appreciate the questions coming from the audience. It's really good to have a dynamic discussion. It's really good to get other people's thoughts and to challenge our speakers here at the Green Room. So again, thanks to the audience for appearing today. Ladies and gentlemen, I do want to just share my screen one moment. Nope. Am I sharing my screen? Are we there?
No.
You're not sharing? Yes. I just clicked the wrong thing, apparently. But I just want to, again, let people know that you can find more information about the really good research that is going on at the Center for Climate Change Communication, Jordan Mason University, and also look at sustainability issues at the Green Institute. You can find the Green Institute on social media at the Green HQ. You can find us on Twitter, Facebook, and Instagram. And I want to thank everybody for attending today. Thanks so much. Thank you very much, Dr. Maibach, for being with us today. And thanks again to the audience for sharing their questions and their time. We hope to see you again. Please keep your eye on the website, thegreeninstitute.ng, for future Green Room episodes. Again, we normally appear every third Friday of the month. However, with the holiday season coming up, we were a little bit earlier this month. But please take a look at the website to see future episodes. And thanks very much for being here with us today, Ed Maibach. Appreciate it, and good luck with your work.
Thank you, Jason. Thanks for the invitation. Be well. Happy holidays.
Happy holidays. And everyone else, thank you very much. Best wishes.
Thank you.
Thank you.